Guys, welcome to another beautiful episode of Clinical Unfiltered. We got Kricket back with us, and we are going to be talking about something she is truly passionate about, and I'm completely ignorant about. Is really it's staining. It's ceramic staining. Is that correct?
Sausha, you're precious, but no, it's not. It's a liquid ceramic, so we like to call it a liquid ceramic. And I'll explain why. But we're going to be talking about MiYO on this.
MiYO. All right. Yeah. All right. Take me down the rabbit hole.
Okay.
Give me like the Hitchhiker's Guide to the Galaxy, the Spark Notes, real quick, so I can ride with you the rest of it.
Got it. Okay. So a little bit about MiYO is. MiYO, it stands for Make It Your Own. And so basically, like, I'm in a practice that does CAD CAM dentistry within the office. And so I started with a system, like a stain system, like Ivoclar has one, Dentsply has one. And so stain, when you put stain on a ceramic, it has opacity in it. And so it blocks the transmission of light. So you're not really able to see the beauty of your ceramic. Okay. With MiYO is an actual liquid ceramic. So it has much more ceramic content in it. So it's fired the same way. You paint it just like you would your traditional stain, and you fire it. But because of the high ceramic content, the light's able to penetrate through the ceramic, and it looks more lifelike, and it doesn't make the tooth look non-vital. If you look at a stain, because the light's blocked, the teeth look non-vital in a lot of cases. But with MiYO, for me, I found it just looks more vital, more lifelike, and the wear resistance is much better on it as well.
Gotcha. So you don't have to fire this thing?
Yes, you do fire it. So MiYO's the same thing. So it's if you think about your traditional stain, like if you're using an Ivoclar system where you paint it and you fire it, it's the same workflow. For me, it's definitely easier handling, but it's not a stain. It's a liquid ceramic because of the ceramic content that's in it.
Okay, so you still got to have a firing unit.
You do, yes. Yeah, you still fire it.
So you've obviously played with other stains. Are you still playing with other stains, or is this like your go-to now?
No, I've done so many different ones. So I've used the Ivoclar system that's in the syringe that usually you start with if you have a CAD CAM technology within a practice, because that usually comes with your Ivoclar furnace. I've used Dentsply. I've used Ivoclar's lab side. They have a Ivo Color. And I used that forever. But when I used MiYO, Sausha, it was just, honestly, it was mind-blowing. For me, I teach around the country on this so frequently. And to put something in another clinician's hands and for them to be so predictable with it out of the gate because of the handling is so easy, for me, that was kind of everything. Another thing for me is with this system, when you fire a ceramic and a stain, a lot of times what you paint isn't what it looks like after it's fired, right? It might overfire and take a lot of your color away. And so it didn't really look as if you intended it to look. And so with MiYO, for me, it looks the exact same after fire. Oh, so like for me, I'm really well known with like the single unit anterior tooth. Like that's like my favorite thing ever in dentistry. Like when I see a single unit anterior tooth walk in, like it is like my whole day is made. Like I'm so excited.
So you just said your single anterior tooth, matching a single anterior tooth.
I love it.
So this is where MiYO is your saver. Is this how
it really is.
Patient walks in. I just busted my front tooth. And I'm assuming I need a crown. Does it matter if it's an implant crown or
I don't care. No, it does not matter.
Gotcha. All right. I don't care. Just pretend it's an implant crown. What are we doing? How's MiYO saving the day? So
the first thing I do is very, very, very important is shade selection, but not just shade selection, like value selection. So if I'm going to do an EMAX case, I do a lot of glass ceramics, and I really love EMAX. I need to determine whether the case is an LT case, an MT case, or an HT case. Okay, because each case is going to be different. So LT, low translucency, is going to be like if I have a patient, I'm going to match a PFM that they already have. So I'm doing number 8. They have a PFM on number 9. That number 8 is going to be a LT. Okay, because I have to match that PFM. Gotcha. Medium translucency is more of
because someone didn't use proper characterization already. You got to match. You got to match the ugly with the ugly. Okay, got it.
Got it. Yeah, that would be LT for sure. MT, I don't do a ton of MT, but it does have a good place when you can. The MT selection shades that you have are much less. So you don't have very many to choose from, whereas you have tons to choose from of LT and tons of HT. So I'll do MT if they are not quite super high value and they're not that ugly LT. Okay. And then of course HT is going to be very high translucency. The key though, Sausha, the key
so
is going to be
these separate kits? Like it's coming like an LT kit, MT kit, HT kit.
Yeah. So they actually
it's like could you forego an MT kit? Like it sounds like you could get a lot done with LT and HT.
Yeah, but there's still a need for MT sometimes.
Okay, right.
But Avoclar has like their shade guides, and they're not the prettiest, so they're very matte, right? And I know they're not glossy, and people really don't love that about them. But honestly, it gives you a starting point, and I really couldn't practice without them. So Avoclar has the LT, MT, and HT guides, and I make sure that I have them with me. They're really crucial to me. The LT guides, though, with Avoclar match the Vita shade tabs usually, so it's not super critical that you have the LT ones, but it's really important. I will say the biggest thing though with shade selection is value selection, and if you ever question, make sure you go higher in value, right? Because if you go lower in value and you have your shades lower, you really can't fix it very easily. You can never really increase value, but you can always decrease value. So the first thing in the appointment is I'm going to look before the teeth are dehydrated and the patient's been open for 30 minutes. I'm going to look at the shade. I'm going to take photographs and I'm going to look intraorally. So I'm going to see things in a photograph that I don't see clinically and vice versa. Okay. So I'm going to make some notes. I usually practice doing everything same day as well. I like to be, like if I'm doing the single unit anterior tooth, I like to be chairside with them, and I like to reference my picture, and I like to reference them firsthand. So I'm sitting beside them with the chair laid back, and I'm like in their mouth looking at doing that custom shading. So that's like the step one.
So you've base selected a shade for my crown already.
I have.
Okay.
Yeah.
Okay. So it comes in, let's say I'm like generally, like I'm roughly, I don't know, you can pick
C4?
a shade. C4, there we go. Yeah, sure. You know what? Maybe. There. So, but I'm drinking coffee nonstop today. So, so you got that base shade, and you're noticing the difference now. That's when you're picking up your MiYO.
Yeah, so I'm picking the base shade, but remember, I'm picking the lightest color. So when I look at their tooth, I want to find the lightest color in their tooth besides a white spot. Okay, minus a white spot. Okay, so don't pick a decalcification spot. So I have a really good friend that's a clinician, and every freaking case he does is like B1, and the patient could be C4, but he knows that if he has a higher value, he can always match it. It doesn't matter.
That's another extreme right there.
I know, but I prefer not to quite work that hard at customization. Right. So I'll choose maybe a shade that might be one value higher. Kind of get in the ballpark.
That's like working on a canvas, like a white canvas. Like, hey, I got to paint the Mona Lisa now.
But I will say everything he does is automatically 2 fires. So for me, when I have an Emax, a purple ceramic, I'm kind of known for doing it all in one fire when the ceramic's purple. I don't focus on the canvas being purple. That doesn't matter to me. I focus on what colors of MiYO are going to go on the canvas, and then I fire it. So with that clinician that I know that does B1 for everything, that he always fires first and then colors it.
Gotcha.
Okay. So I try to skip 2 fires if I can, because as we all know, chair time is money. So I want to be as fast as possible. And if I have to do another fire, it's not the end of the world. I can just do another fire.
Painting, like the process of actually picking up the MiYO and painting it on. Are you how are you handling lighting, moisture? How are you actually going through those steps specifically?
So I do wear loops. I practice with loops, but it's really important, especially when you're working with a very light shade, like if you have a B1 ceramic, because if you have a really bright loops light, it's going to wash out what you're doing. Okay, so be very mindful of my light. I have a luminant light, and I can adjust the settings super low. So I will look with my loops light and without it, just to make sure that I'm kind of managing the shades that I'm putting on the ceramic. So that's one thing. I will say, as far as doing this custom shading, my friend that I was telling you that it's another clinician, he likes to actually put the single unit anterior tooth on the patient's tooth. So he has an Emax usually that he works with. He puts it on their tooth So if he's going to do a number 8 and he's going to match number 9, he's going to put it on and he's going to paint the ceramic on their tooth. Okay. And then he's going to tease it off and try to get it on a fire and pin and fire and putty. And that's just too stressful for me. I don't like to work that way. Yeah. I like to sit beside the patient. I have the ceramics supported properly, the Emax with the fire and paste, supporting my margins, my fire and pin, making sure it's not touching the intaglio of the ceramic because we're dealing with a glass ceramic, right? So we don't want to push that fire and pin into the ceramic because it could fracture. And then I want to sit beside the patient and I hold the ceramic and look intraorally and paint. So MiYO has different colors, right? So they have like shade A, shade B, they have clementine, they have storm and smoke. So they try to create like little creative names, right? But it may not, like I'm looking at the patient and sometimes the patient has an incisal color that's more blue and sometimes they have an incisal color that's more gray. So I just paint what I see. So if I see that they have a blue incisal, I'm going to paint their tooth with storm. Storm is MiYO's blue color. If I see that they're more gray, it's going to be smoke. And then as far as the shade A, B, C, and D, they tried to make it easy to where if you pick a shade A2 for your patient and you need to put gingival warmth around their CEJ, then ideally you would grab shade A and do that gingival warmth. But not everybody is going to have a shade A gingival color, right? A lot of patients will have more of like a sunsetty color, which is MiYO's like clementine color. So I'm really looking at what they have. Okay, so the key is like, look at what they have on their tooth. I have a white tile that I get from Lowe's, and I put the colors on the tile, okay? And I just mix and make what I see in their tooth. And then I paint it.
I see the slide that you have. I'll put that up with the different shade colors.
Yeah.
Yeah, clementine.
Yeah.
Where's MiYO made out of? Where like where's their manufacturer? Who's their?
So Jensen Dental is the manufacturer of it, and so
okay, gotcha.
To get MiYO, you have to order it specifically from Jensen.
I think that's a huge factor to be able to see, because that's the thing. I've seen lab technicians like paint ceramics and then they fire it and they're like, oh, I anticipate it to look like this. I'm like, well, how do you know? And I've seen it come out and I'm like, that's not what we kind of wanted.
Yeah,
and it's back to the fire, and it can be a tedious process. So to be able to see something and have it directly replicated it makes it a lot easier to use. This is like, again, surface knowledge of MiYO, but I was told that there are instances that you don't have to fire it. Is that true, or you got to fire it all the time?
No, MiYO for a ceramic has to be fired.
So there's no instances.
There's no instances where you cannot fire it.
Are you putting it on? Well, I mean, I'm assuming you're using it on any final restoratives. Have you put it on any interim restoratives, like an On-X or anything like that, to see how it does?
Yeah, so good question. So a lot of people come to me when I'm teaching MiYO somewhere, and they say, can I use this for my 3D printed crowns? But MiYO, remember, it's a liquid ceramic, so it's intended for a ceramic, not a resin. So if you're going to do something with resin, you're going to have like OptiGlaze or Empress Direct. Those are light cured for resins, but MiYO is only for zirconia or gotcha. Emax or Empress or any glass ceramic or those types of materials that
you're doing
have
it on final hybrid prosthetics as well.
Yes, yeah.
Gotcha. Yeah. And now let me ask you this. I mean, like final hybrid prosthetics. I mean, I'm assuming it's a significant amount that you're using on a final prosthetic, like final hybrid prosthetic firing units that you utilize for these. Like, how long are you firing them for?
Yeah.
Like if they're coming with a final zirconia prosthetic and you've painted it on, like you put it in the oven, what's the time length on that?
So really good question. I would say a couple different things to that question. Number one, when I'm doing a hybrid, as a lab technician within a practice, I do a lot of chairside dentistry, but I also work with other technicians, and I want to finish my own hybrids for my patients because I'm just that person, right?
Are you getting them in green state, or are you like?
No. I'll usually have them center it for me and send it to me, and then I finish. I just want as much control for the prosthetic as possible. But for me, I will say when I use it on a hybrid, I'm using two different parts for my hybrid. So number one, I'm using the MiYO color, and the color is just basically the pinks that I put on the tissue and the colors for the teeth. So personally, I like to do a hybrid to where I'm not starting with a pink tissue. So you can actually infiltrate your zirconia, your tissue pink, and then center it. So when it's finished, then you have pink tissue and then white teeth, right? So
Right.
I prefer to not do that. And I prefer to have everything to be white. And I think
Okay.
of it as like our bone under our tissue is white, right? And our
Gotcha.
tissue's
Yeah.
on top. So I will take the prosthetic and I'll put the MiYO colors on it, the pinks on it, and I will
Gotcha.
fire a color cycle. That's going to be maybe 30 to 40 minutes. But
Okay.
that's not the like game changing
Are you
thing.
doing that chair side too? Like you got the hybrid, you got the pink, or are you doing that pre-patient coming in?
No, this is like, yeah, they're not waiting on me for this.
That's a lot. Yeah, so that'd be a lot. Yeah, yeah, gotcha. I was like, I mean, you could probably get the best pink match if you did it
Uh-huh.
that way, but
No,
yeah. Yeah.
But I'll go ahead and fire that MiYO color. And so I do the teeth, the MiYO teeth, and the MiYO color. So that's just the paint that's going to feel like a stain that you're used to. I'm going to fire it. Be very mindful of the heat rise and heat cool with zirconia. So make sure if you ever wanted to do this within your practice or within your lab, you're going to make sure that you're not increasing heat too high, too fast for zirconia, or cooling it too fast, because your zirconia, of course, can fracture. So that's a really big thing I would caution you with. So make sure you follow the manufacturer's instructions on the heat rise with the zirconia. But after that happens and it cools, I now have some nice pink tissue and I have some pretty teeth. We're good to go, right? But tissue is not just flat and glossy, right? That's really where you really can make your hybrid stand out. So Jensen with MiYO has something called structure. And structure really is great for us clinicians because it is porcelain, like you're stacking porcelain, but it feels like composite. And like we work with composite every day, right?
Mhm.
So I'm going to basically use this composite, this structure composite, and stack it on the tissue so I can create some anatomy in the tissue so it's more realistic. So I'm going to do that, and then I'm going to fire it again. So another application for MiYO structure that we're going to use a lot of times in clinical dentistry is contact addition. So a lot of times if we miss a contact with a crown, right now you might have used like the Ivoclar liquid and the almost like powder, and you mix it together like traditional porcelain. Okay, that's what
Yeah.
normally you would use to add the contact, right? So with Jensen, they have structure and it feels like composite. And I'm literally just taking the composite filling out of the jar and I'm putting it on the side of the ceramic and firing it. It's like an 8-minute fire.
Oh,
And
wow.
I'm not having to remill my ceramic. And it basically is adding porcelain to the side of the ceramic.
Oh, that could be huge. I mean, like, again, my office I send back. I don't, but that would be huge. I mean, I mean, like, you lose a contact there. It's just
Yeah. And it's a super easy, quick fix. Yeah.
I think realistically, most doctors that probably listen to this that are doing hybrids are probably getting them in pink. I mean, we're getting them. They've been pre-stained and everything. They've got the gingiva, but the life isn't really there. So
Yeah.
I feel like the structure would actually probably play a bigger role in our clinic for us to be able to kind of characterize the gingiva a little bit. The structure is mainly for the gingiva, or does it play a role in the?
It's great for the gingiva because you can stipple in it and create that texture with your gingiva. But you
Gotcha.
can also do it for
more like
teeth.
a physical addition. Okay.
Correct. You could do it for teeth as well, but teeth, so structure is just basically porcelain, but it's not to make things look more aesthetic. It's just to add anatomy and texture. Like
Gotcha.
Structure was intended for A, contacts, or B, anatomy and texture. So if you want to put into a ceramic, like a crown, more texture, then you could stack structure to it. But it's not going to give you more beauty for the ceramic. So that's why more so it's intended for tissue, to give you structure or to give you anatomy with your tissue to be more realistic.
Like when we do our hybrids, when we get them back, this is something that I'm definitely going to be looking into implementing. Now, you obviously, I mean, you've gone around, taught MiYO. The doctors are taking your courses. I'm assuming they're wanting to learn how to do this. Do they delegate this task a lot, or is this something that you feel like dentists do a lot, or they delegate it more often?
Yeah, I'll say most dentists that I teach, they don't care about doing a hybrid. That is like the bottom of their totem pole. Okay.
Okay.
They don't care about, so like in a course, so I teach a course with CDocs and I make the clinicians in the course do a hybrid. We do a little mini hybrid, but we do tons of single unit anterior stuff because that's what these clinicians want, right? If you're a chairside dentist and you're producing dentistry chairside same day, they're not looking normally to do a hybrid. They're looking to do like, how the hell do you do single unit anterior teeth? That's what I want to learn.
We're battling that problem.
So I teach more of that. And I will say it's different. So if you can like focus in on a clinician in your practice that really just seems like they have a super big interest in ceramics and they have a passion for it and you can see the fire light within them, then delegate to them, like invest in them and train them, and they could take on this that maybe you wouldn't want to add to your plate.
I've seen a lot of doctors who are like, they just use like multi-layered, they use zirconia for like every tooth. Every tooth. Do you think you can achieve with like MiYO aesthetics on an anterior tooth with MiYO on? No, I mean, maybe not. I mean, maybe not a B1 monolithic, but can you with a zirconia-based crown?
Yeah, so I've never been able to achieve. I'm so picky, Sausha. Like okay. You have no idea. Like my patients come in and they think they're pickier than I am, but it's not possible. Like I'm so picky, and I've never been able to achieve a monolithic zirconia anterior tooth that I was happy with until MiYO. Like it honestly, it doesn't look monolithic. It looks layered because with MiYO, I can layer colors on top of colors and not muddle the colors together. They literally will separate on each other. So it looks like the ceramic is layered.
Gotcha. Okay. So like that whole process of it being stacked and right next to each other, you're still having a good separation of that color.
Correct. Yes. And I don't have to do multiple fires to create that layering. I can, because of the way MiYO handles, I can just do, one fire and put colors in different areas or colors on top of colors, and it still handles nicely and fires nicely.
What's the longevity of this material? Like, so
it's still an external, right? So it's not internal. Like if you're doing infiltration in green stay, it's internal, right? It can't come off. It's still external, so it still has a wear rate, but it's just much less than a traditional stain.
Okay, but if you had one of these like against another monolithic zirconia, you're probably going to wear it a little bit quicker, I'm assuming. I mean, what if you have like MiYO on MiYO?
Yeah, you would, but ideally I would want to, I would try to polish the occlusal surface of their zirconia any chance that I get, just because of the abrasiveness to zirconia. So one day, years and years and years down the road, say our MiYO really wears, it's going to wear into that abrasive zirconia, right? So I would choose to, if at all possible, polish the contact of zirconia to the adjacent tooth, and then MiYO anything on the outside.
On the outside, gotcha. Yeah, you can just do it again if it's that easy to do. Yeah. And if you wanted to get into MiYO, like if you wanted to start playing with MiYO yourself, and I mean, for the docs listening, what's your favorite resource to go to? Like, where do you go to pick it up, play with it, and learn to use it before you actually throw it on your patients?
Yeah, I will say Jensen does something really good to where when you want to invest in MiYO and you purchase MiYO, they give you a money-back guarantee. So you use it, you feel it, you practice with it, and if it's something that you really don't love, they'll give you your money back. So it's not like an investment that you can't get a return on, right? I promise you're going to love it because it's really been a game changer for me. But that's a huge thing. Jensen, their website has tons of videos on there, as well as I teach a course with CDocs on it, and we focus on MiYO. So everything that we do for 2 days is MiYO. So anything that you can have just hands-on with MiYO, it really will be huge.
I've heard that a lot. I've heard like people who've picked up MiYO, they're like, well, okay, I can now do this.
Yes. Very easy to implement.
Yeah, it's easy to use, and that's actually like that's what, again, for me, I'm a lazy doc. So like when I run into something that makes my life easier, I like to it brings me back in. So the whole idea of messing with definitive crowns I think this might actually draw me back in to get a little bit more hands-on with it. Although we will have another episode at one time about printing definitive crowns, which I'll want to talk about too. And talk about how that whole process goes. But again, Kricket, thank you so much. Everyone who's been listening, drop a like, follow. Remember, we're not getting paid for this. So your contribution really does help when you share, like, and follow and comment. Thank you guys again. Take care.